we're going to talk about IPL since most of us are on our phones more often. We are doing Zoom calls. We are on social media. We are taking all those fabulous selfies of ourselves. So we are going to talk about IPL and the benefits that's going to help create the best versions of ourselves on screen. Welcome back. Nice to see you again. You look amazing.
Oh, thank you.
IPL, what is it?
So IPL is an acronym for Intense Pulsed Light.
All right. And what does it treat? So it's a laser.
Nope.
It's not. Okay.
So if anybody has seen or remembering when we talked about laser hair removal.
Right.
So a light, talking about wavelengths of energy,
yes.
A light is a whole bunch of wavelengths together.
Right.
Visible light is a whole bunch of wavelengths that come together to make visible light. A laser is one wavelength. So intense pulse light will be a bunch of wavelengths, and you can use those bunches to target specific pigment colors. So if you want to target red,
yes,
or you want to target brown, so sun damage,
yes,
rosacea,
yes,
those kinds of things.
Yes.
So you can put filters, you can adjust your IPL machine so that you can target specifically red or brown or both.
Okay. So I suffer from rosacea. Now I've had VBeam.
Yes.
So is that the same or is it different?
It's different. So VBeam is a laser, so it is one wavelength targeting red. I actually think if you're coming in for just rosacea,
yes,
you should have VBeam, the pulse dye laser. Its wavelength is more specific to red, but a VBeam laser will not touch brown. So IPL is, I think, the best choice if someone's coming in with lots of pigment, like browns.
And like Malaysia or not?
You're thinking of melasma. That's another topic that has to be handled with care.
Right. Okay.
That is a pigment problem, hormonal, deeper pigment, and it can actually be worsened if you go and put an IPL on it or administer light to it. So you have to handle that one carefully. You need to make sure you go somewhere where they're aware of the pattern of melasma, recognize it in you, and then get you on skincare ahead of time, and can be preventative at not allowing worsening of the pigment.
Okay.
Versus sun damage, which is a very superficial pigment more likely and will respond really nicely to IPL.
Now, is this something that is more age related, or is it, how do you determine if you need to have IPL?
So I'd say it's age related in that as we get older, we've had more sun damage, but a 20-something can also have had sun damage that needs treatment. So if you're noticing brown spots, it's time to have an IPL.
It's time. It's time to investigate it and ask for sure.
And get some sunscreen.
Right. Okay. So let's talk about treatments. How is the process, and what is the process of a treatment?
So IPL is best done usually in a series of treatments, especially when you've never had it done before. And usually you would do 3 of them, and you do them in the fall or winter when you don't have a tan, because it will burn you if you have a tan, because it's going to target your tan. And the first session, you'll probably notice the biggest change.
Right.
Because it will get all the low-lying fruit pigment, the pigment that's really easy to get.
Yep.
It comes up when you have the treatment. It takes about half an hour, probably 45 minutes, and it brings the browns to the surface, and then your skin will feel a little bit rough in the brown spots as it's lifting, and then probably in about a week or so that comes off. Okay. So you don't really have downtime with it, but your pigment will look a bit darker.
Right.
For about a week after you've had it done.
And how long should you stagger the treatments in between?
I would say 4 to 6 weeks. And that will give you the best
results.
Yeah. And then going forward, if you're really good at sunscreen and skincare, using a retin-A and a vitamin C and your skincare like that, then you could probably get away with 1 IPL a year.
Really?
But if you let it go for a while, you're going to build up a whole bunch more, and you'll probably
Right.
need the series again.
Right.
Yeah.
Interesting.
Good for chest as well.
I was just going to say that. So it's not just for the face. You can
And hands, backs of hands.
really, yes, because as women, I noticed that
It ages us.
It ages us, so that's interesting. If any kind of spots or anything like that, it'll take off.
Yeah.
Very interesting. Okay, so as you were saying, you only need to, then it becomes a maintenance. I always like to ask this. I do have a high pain tolerance, but I always like to ask, what's the pain associated with it, or what can someone expect from the treatment?
So you do get eye protection, of course.
Right.
So your eyes are protected. It doesn't hurt that much, but it makes me jump.
Okay.
So usually when the technician is administering the treatment, they'll tell you when they're going to push the button, but it makes me jump because it's so bright.
Right.
But you're protected.
So it's not necessarily painful.
Well,
it's just a little bit.
Yeah, it's hot.
Right.
But it's very, very doable.
Right. Mm-hmm. Okay. Is there anything else that you can add to?
Oh, one thing that people might be wondering about is a BBL versus an IPL.
Yes, very good.
So broadband light,
Yes.
intense pulse light. They're basically the same technology. It's just different branding.
So it has
They're very similar.
the laser technique and
Not laser, light.
light.
Yes.
Light is the same.
It's similar, like you've got these filters, and so you can filter certain wavelengths to be administered depending on what you're trying to treat. And also like skin type, so you can
Okay.
be careful with people with darker skin types and use different wavelengths and different filters.
All right. Yes, because I have heard just even more recently a lot about BBL and
Marketing.
okay. So, as someone who is interested, like myself, who thinks, okay, come in for a consult,
Yes.
and what questions? Is there any typical questions, or is it just booking a treatment and?
Yeah, I mean, you don't want to have a tan.
Okay.
You mean the questions that you would ask?
Yeah, as if someone's walking off, and looking and interested into it, what's something that would set that light therapy apart for them to ask?
Well, I think there's lots of different brands of it.
Right.
So I think you just want experienced
Technician.
Yeah.
And
recognizing melasma and that kind of thing.
And I think that's something that we've touched on a lot is just, technique is going to be, I'm sure, as in many cases, the biggest thing is if you have a technician who understands skin, understands the issue, is going to be able to treat it. And not everyone's going to be the same. Everyone's going to have a different way of treatment. I know.
Yes.
Yeah. Well, that's just adding to my list of things. All right. Well, I think that that covers IPL, and if anyone is interested, certainly call your clinic and book a consult. Sounds great.
Yeah.
Thank you.
Yeah, thank you.
And that concludes this episode of Be the Best Version of You.